It's a delight to be here. It's a delight to be here. I'm in Florida actually, so I'm Professor Emeritus from George Mason University, which is in Virginia. And you all are seeing the fall leaves, I'm sure. We see palm trees blow and hopefully not too much this time of year. It's knock on wood, it's been okay. It was, I don't know, what was it? Annabelle's before your time, with Eric and Dave Clausen 5, 6, 7 years ago. I came and spent a full
Mhm.
day in Chicago with IHEC and
Yeah,
some of
that's
your some
2017.
some of you and maybe some of your predecessors and colleagues. It's a delight to be with you, and I'll be in Chicago again in January. I have a slide that will just highlight that, and so we can talk more if you need to do that. I'm going to share some things with a couple of different resources focusing on strategic planning. Our title, when I do the share screen, and you've seen this before, is Orchestrating Meaningful Drug and Alcohol Misuse Prevention Efforts. So this is all about being meaningful, being practical, being organized. So let me start sharing the screen. We'll have time as we get towards the end for some questions. And then there's also the opportunity to follow up. So if you wanted to send an email, if you want to set up a Zoom call or a telephone call or snail mail, happy to do that. Again, these slides will be available for you after the fact. So I'm going to share the screen. Annabelle, you can verify that this is showing. Okay. So this is, again, meaningful. So when I started in drug and alcohol misuse prevention, it was 1975. And you're going, oh my God. Oh my God. 1975. So I was a residence hall director, and actually I started doing some things before I did something specific on drugs and alcohol. But a lot of issues in the residence hall. I had an all-male hall of 450 men, and then a co-ed hall of 700. That was at the Ohio State University, and we learned how to say "the" when I was there. Um, but but so many of the issues that I faced as a hall director had their origins outside of just the behavior. So it was alcohol fueled, alcohol inflamed, it was drug based. We did a lot of environmental strategies. We can talk about that. The all male hall I had was where the football team happened to live. Most of them, 90% of the football team lived there. So those are other stories, but I wanted to do something that brought me upstream. How do we start to prevent these things? And so just in terms of context, when you look at our national efforts, National Institute on Alcohol Abuse and Alcoholism, National Institute on Drug Abuse, we rely on those today, but those had barely started. When I started in 1975 with my first residence hall program, NIAAA and NIDA had just been founded a few years before, so the word wasn't out. So there wasn't a whole lot of public awareness. So what I want to share with you is some of that insight, not from what we did then, but what would be meaningful today, some context, some competencies, and some collaboration. So that's where we're going. We have learning outcomes. You've probably seen these in the marketing for this. I want to make sure we end up being practical, so it's doable. I want to help you enhance your confidence. And often when I do talks, I talk about what I call the pyramid of success, which has three things in it. Competence, that's your skills, that's your knowledge. Confidence and commitment, staying with it for the long haul. Just as a sidebar in terms of commitment, yes, I've been involved in this for now 50 years, 50 years. Why? How? How do we maintain? And for those of you who've been involved with it, with prevention for 5 years or 10 years, how do you stay with it? If you're just getting involved or thinking about being involved, why? And that's important to know. So we just had this week a colleague, Katrin Wessner, out at University of North Carolina, Wilmington, and I had a program proposal approved for the NASPA Strategies Conference in Chicago. So we're going to share and really have a roundtable type discussion about how do we keep that confidence and that commitment. And then opportunities. So this is all about potential. This is about what you call in force field analysis, the desired state of affairs. Here's our brief outline. We're going to go through all of these. And I just want to highlight these four. these four clusters, these four bullets represent 9 parts of strategic planning. So you'll see that unfold. And what I'm going to do is blend 2 different resources into this presentation. So I think you'll see how it all fits together as we go through it. And this is where we're going today. This is one of the 2 resources. This has the 9 elements of strategic planning. You'll see that in chapter 10. It's under collaboration planning processes. And so this book was published by NASPA just 4 years ago. It's a lot of practical applications in here. That's one of our foundations, this book. And there's some worksheets in here. You'll see me highlight those. So I'm going to be speeding through those, not belabor those. And as shared, a lot of these are going to be available on my newly developed website, not yet public, but it's to be developed. And I'm in the process of doing that right now. If anyone wants to help, we can talk offline. But in terms of this, I'll put these worksheets online so you can download them. So this is meant as a how to think guide. And this is the model that I'm going to use. In the book, it's a black and white visual, and we're going to go through these 9 steps. And this helps make it practical for you. This is the other resource. This was funded by the Mid-America Prevention Technology Transfer Center. It's available at preventioncompetence.org. So again, you'll see more about that. This is the framework we use. There's 8 elements in it. And again, these will all be highlighted as we go through the 9 steps of the strategic planning model. In this guide right here, this resource is downloadable, it's free around this framework, health enhancing environment. You'll see competencies, and it's organized around 70 applications across those 8, 95 skills, and 101 competencies. So that's 266 competencies overall. Now, what does that look like as you actually look at the guide and download the guide? Here's what it looks like. If we take one of those areas, strategic planning, you'll see that each of these, there's some specific items within there. There's between 7 and 10 sub-competencies within the strategic planning competency. So as an example, here's one of them. And you'll see here how the knowledge and skills feed into the application. This particular one, there's always a single application, so there's 7 to 10 of those in those 8 core competencies. So this one happens to have 3 knowledge items and 1 skill. So that varies in terms of how many there are. Then in this same guide, we have resources for each of these 8 sections. So this is key strategic planning resources and some other supplemental ones. Then we also have 4 different types of other resources at the national level. There's federal agencies, there's national organizations and resources, there's news and information resources, and there's data sources, all with URLs. And then there's a webinar series, again, all free. So if you want to hear more about the competency on leadership, the competency on environmental strategies, the competency on drugs and alcohol, 45 minutes to an hour, all available. And again, that's online through the URL preventioncompetencies.org. So a little bit of context before we jump into the 9 strategic planning elements and the 8 professional competencies. A little bit of context. So here's a couple of slides that the DEA has put out. This comes from Monitoring the Future. What you see here is that if you see the black line, the college students, this is the 5 or more drinks in a row at least once in the last 2 weeks by traditional age college students. If we had that line go back, or the horizontal line go back 20 more years, that would have been at 40 to 45%. Look where we are now, 21.9%. That's really amazing progress. Lots has happened over that decades of tracking, and then those are in part due to the efforts we're doing. If you look at marijuana, more recently, that's spiking up. That's the cannabis use is up. If you look at the college drug and alcohol survey, Annabelle mentioned that I did this workshop or did a workshop on this data a few months ago. And so that's available. You can dive into all the data, whether it's policies or programs or recovery services or strategic planning, organization skills, personnel. But one of the things we do is we ask the respondent, and this is the 4-year school data. The 2-year school data is also available. We did that for the first time in 2024. But to what extent is alcohol involved with campus violent behavior or property damage? And what you see on this slide and the following two is a reduction. Look at this we're tracking this starting in 1985, so 40 years ago, and it's gone down. It's gone down modestly, but it's gone down. Same with alcohol's involvement with personal behaviors. And so much public attention is given to the mental health, the emotional difficulties that students may face. And so that's important. But alcohol, just alcohol, we're not tracking cannabis, we're not tracking other drugs with this particular question. So personal behaviors down, and then academic issues. And this is what faculty often care about. And so ways we can present this. So even though it's down from where it was, it's still a notable contributor to these various sets of problems, academic included. So here's a slide that I put together that's like a summary of everything. You'll see this again later. But this particular slide, if you wanted to step back, if you want to do a just screenshot of this, these are my key philosophies. You need to focus on specific outcomes. So it's not just reduce, but what do you want to do? Do you want to reduce negative consequences? Do you want to reduce and/or use? Do you want to reduce perceptions of harm? So be really clear with what you want to get, what you want to achieve, and or what kind of outcome in a positive way you want to do. You'll hear more about that. Be locally appropriate. So what's true for Northern Illinois may not be true for Eastern Illinois University or Southern or Western, or for what's happening in Ohio or New York or Texas. Grounded based on evidence informed. There's evidence-based and evidence-informed. We'll talk more about that. And current best practices. Be comprehensive. So just a policy, just a program, just staff training, just faculty engagement, not enough. Comprehensive. Meet varied student needs and learning styles. Utilize a systematic strategic planning approach. Again, that's what we're diving into today. Proactive and innovative does have a place. And then the overall campus culture. So it's not just drug and alcohol use, but it's also issues such as belonging because that becomes a protective factor. So now we're into the first of those four clusters. This one has 3 of the strategic planning elements. You'll see those. And then you'll also see 3 from the prevention competencies. So this is the framework. The first strategic planning piece, validate your foundations and your impetus. So this step and what you're going to see shortly are often overlooked. People jump into, if you look on our slides right here, they jump into plans and strategies rather than these other 5 areas that come before it. So foundations and impetus. What's your why? Why are you doing this? Why did I get involved with drugs and alcohol? Because I saw people drinking and drugging and having negative consequences. I saw people literally physically beat up other people when they were impaired. I saw death from drunk driving. I had to pick up pieces, not physically. The physical one is when I had to pick up with a squad member the body of a drug overdose dead young lady in my residence hall at Ohio State. Drug overdose, mid-70s. But what is your why? What is your campus's why? Why are you getting involved in this? That's important to think about and to remember. There may have been a crisis. There may be a change of your governing board where someone has this as a passion. I know it's soft, it's fuzzy, but it's important and it helps keep you going. Part of my why is I thought people were making decisions without even thinking about it. You'll see that theme come through with my latest book coming out this week. More on that to come. Develop your core foundations. That's the second step. What are your core foundations? So with this, again, this is often overlooked. But what is your overall vision? What is your president's or chancellor's overall vision? How can you dovetail with that? What is your chief student affairs officer's vision generally? And then what is it with respect to drugs and alcohol? How does this all fit into the campus mission statement or your departmental mission statement? No, and don't think just of your what you want to prevent. All those negative things surrounding drugs and alcohol. What is it you want to promote? Those resiliency factors, those support factors, those positive factors. Reduce the risk factors, promote the resiliency factors. And then what are your guiding principles? Again, these are so often not specified. Whenever I've been involved with campus task forces, I want to make sure it's going to be meaningful. And I'll say, I just want to make sure that this is going to see light of day, that we don't have a shelf report. We have a self report that's actually going to be usable. I want to make sure that there's meaningful, and I say this, there's meaningful student involvement, not a token student government representative. I want meaningful student involvement. I also want to make sure that there's meaningful faculty involvement, not again, a token representative. So what is it that are your guiding principles? So locally, I was on our governing board for the community in which I live in Celebration, Florida. I was on that for 7 years. COVID happened in the middle of that time. We immediately discovered what Zoom was, as many of us did. But I said, as we're dealing with this pandemic, and picture March of 2020, and so much that we didn't know. But I said, we need to develop our own guiding principles. Safety of our residents is number one, health and safety, listening to authentic medical professionals talk about this because it's a changing target. My sidebar there is not listening to the politicians, listen to the medical folks. I got involved with the COVID task force for the American College Health Association and learned a lot from other medical professionals. I'm a public health person, not a medical person, but there was so much that I would hear and read about with a lot of the articles and the science that was coming out. But this was about guiding principles. So what are your guiding principles? And what are your desired outcomes and processes? Again, with this, as with so many of these, I have worksheets. I know you can't see these, but just to give you a flavor that worksheets exist that help facilitate your own local application. And that's what this webinar is all about. Your own practical application towards being more effective. So now we dovetail back into the competencies guide. And so within this cluster of elements from strategic planning, there's several different competencies that I think are important. Grounded in prevention science, not on a whim, not grounded on what the boss wants. We listen to that, but grounded in science. And so again, you'll see within each of these 10 elements within prevention science, I already showed you the mock-up for one, but we have done that 10 different times. And again, there's more resources for the chapter on prevention science. SAMHSA, the Substance Abuse Mental Health Service Administration, has resources on their website. There's, again, various resources there. And then this is a screenshot I took. I'm on the National Advisory Board for the Center for Substance Abuse Prevention. And so we had a meeting of fall a year ago. And so the new director came in and said, here are guiding principles. That's what that says in the middle of that screen, that blue screen in the middle. These 6 themes were important to him and to the leadership of the Center for Substance Abuse Prevention. So think about what your guiding principles are. So again, part of this also is document your baseline needs for your campus. How do you document that? And so Think about needs assessment processes, whether it's the NCHA, the National College Health Assessment, or some other campus-based approach, or I know you have statewide assessments. So quantitative is important. Qualitative gives you even additional information and further insight. I did an online assessment. You'll see Alcohol 101 Plus mentioned later in the presentation. We did a follow-on assessment, and we had, I don't know, 6, 8 questions where we, it had a yes, no, unsure response. And then for those who said yes, we said, tell us more. Why'd you say yes? Those who said no, tell us more. So that's qualitative, and that gives you some rich insights. It gave us, my co-author and myself, some very rich insights that otherwise we would not have had. So that is vital. So think about that. And again, there is something in the competencies guide that will be helpful for you. Again, these 10 elements in the needs assessment, evaluation, and research segment. You'll see this particular slide again later. And again, use current drug and alcohol knowledge. That's important. That dovetails right into prevention science. So the second broad cluster out of 4, second broad cluster, organizing personnel and groups. Now, in the whole flow chart of things, you'll see that that's actually right at the beginning. So the why becomes that foundations and impetus is really the very beginning. And then we have organizing groups right there in this flow chart. For the presentation, I put it later. But that means you're not doing it alone. You need a coalition, a task force, and/or advisory group. So that's so important. And think about the traditional partners that you've thought of before. Think also about the non-traditional partners. The non-traditional partners, it's student government or alumni or marketing classes, often overlooked and so vital. Think about this. This was a worksheet. This is something I did 25 years ago. That one on the left is a kind of like a task force planner guide. Across the top on that, I don't show it in the slides here. Across the top are the types of things campuses are doing, from policies to education to training to support services to evaluation. And then vertically are 10 different categories, from campus leadership, like the college president, to faculty, to student organization leaders, to the community. So in those cells, again, 80 cells, 8 by 10 framework, what are the types of things that particular row of people, like student groups or student organization or faculty, could do with each of the 8 thematic areas? And you'll see then, again, a worksheet. Program management, as you look at these 9 elements, 2/3 of them are personnel based. So program management isn't just organizing the event. It's about the personnel who are engaged with implementing things on the campus. So program management, again, with the professional competencies guide. Here's our third area, third broad cluster. Your areas of focus, your plans, and your strategies. So first of all, think about your constructs that you use. So again, it's not willy-nilly, it's more thoughtful, it's intentional, it's planned. So using your own local results, the context on the campus, going back to your why, and then look at some evidence-informed things. I have a few examples here. Institute of Medicine's protractor, I'll show you that on the next slide. And looking at root causes, and I'll illustrate that in a moment. So in the protractor, and Tom Hall and I, the co-author on the book published by NASPA, upon which these 9 strategic planning elements are based, we have 3 chapters on these prevention elements. What is universal prevention? We do that all too often, just the one approach for all. What is selective? That might be targeted. It could be first-year students. It could be fraternity sorority. It could be student athletes. It could be other targeted groups. It could be certain majors. And then indicated when those who have been somewhat harmfully involved, perhaps students who've gotten admitted to the emergency room, or students who were in a drug or alcohol related infraction. So we have a chapter on each of those. So think about that, because those might be different yet complementary strategies. So that's something you can ground your efforts in. Think about the socio-ecological model. So what can you do at the individual or the interpersonal or the institutional community and so forth? What can you do at these different levels? You be guided, and this isn't when I offer these are potential elements that help ground you. So you might do a little bit from here. You might use the health belief model within the selective prevention activities. So again, using various theories. The health belief model is one that's been around for decades. I mentioned thinking about the root causes. Look at the percolate up model on the left. If you look at the top there, organization and resources, we have a lot of good organization. We have a lot of resources, but clarity of outcome, I've highlighted that. What is it that you want to prevent? What do you want to promote? Be as specific as you can. Harness the passion is that's getting others involved. And then what are root causes? So there was a think tank like 25 years ago, and this is what came out of the root causes, these seven themes. These seven themes. So optimism and values, and all those are linked into the root causes. All those are linked into drug and alcohol misuse prevention. That percolate up model was the basis of a conference on drug and alcohol misuse prevention. So out of that, and here's a quick sneak preview, that's the framework. Those are 7 chapters in this book that is coming out this week. More about that near the end of this session. So preparing plans and strategies. So that's now when the rubber hits the road. What are your plans? What are your specific plans? How do you organize? So think about a planful, not ready, fire, aim, but ready, aim, fire. Think a menu of strategies. Look at those. Look at NIAAA's College Aim publication. Look at your local needs. Again, think back about those key elements that I cited earlier. Look at your logic model. I'll show you an example on that in a minute. As you're doing this, this is where strategic planning is all about. Plan change is organized. You think about what end do you want. Stephen Covey talked about beginning the end with the end in mind. Plan change is a field of study. You think about the desired state of affairs. And you think about your current state of affairs. And you think about what approaches will help move the line from from current to desired. And then what is in the way? What's blocking it? Think about your SWOT analysis or the Eisenhower matrix or force field, which is what I was just describing with plan change. Think about prioritizing and being purposeful. So strategic planning is a process. It's thoughtful, it's organized. Sure, it takes effort, but the payoff is there. Again, you've built your foundation, you're being locally appropriate, you're honoring your why, you're looking at evidence informed, you're looking at things that have a theory under them if they're not already established. College AIM is already proven in various settings. And again, this is individual and environmental in their framework. This is a resource I co-authored and directed around the country. Yeah, 2001. Yes, it's dated. But if we did a 2026 version, what I would do is take out some of the innovative things from the turn of the century, like, believe it or not, innovative then was website and CD-ROM, believe it or not. Yes, we're laughing. That's what innovation was then. Basics was early on, so that's much more established. So we would add some newer things. A lot of the rest, 80 to 90% of this book is still valid. This is available online. There's still some good ideas in there. Look at the strategic prevention framework, again, out of SAMHSA and CSAB. And then prevention with purpose from the DEA is based on the strategic prevention framework. And there's chapters, there's graphics, there's resources, and there's updates. There's also some online quick video snippets on those. Here's a logic model. We have this in our book where where the strategic planning, the 9 steps are. So this is a worksheet that you can use to help your own strategic planning in a logic model way. Again, some worksheets available there. Now turning, again, within that same area, here are some of the professional competencies. So strategic planning is one in and of itself. And program management, again, you saw that before with personnel, but there's some elements that tie right into strategic planning. Of course, thinking about policy and environment also, again, with these 7 sub-competencies. Now, the last broad cluster is evaluation, review, and institutionalization. So again, you want substantive evaluative approaches. You want quantitative and qualitative. You want outcome and process, reasonable and appropriate. You know, you're not going to ask 200 questions, but what is manageable for you? Where's it you can see whether something is making a difference or something along the logic model? Maybe it's some of the awareness. So that's where, for example, with communication campaigns, you have some assessment of whether someone saw the campaign, whether they liked it, whether they believed what was said, whether it moved them to action. Those are all reasonable assessments, but that's part of your evaluation. Because if they didn't see it, you know, it's like the tree falling in the woods and no one's there. So evaluative, quantitative, qualitative. You need both. You need the data and you need the story. You need the data, you need the numbers, and you need to understand what's beneath the numbers, as I shared earlier. Again, some worksheets that'll help. Again, you've seen this slide before, early on in our needs assessment process. Again, these 10 sub competencies are helpful. Here's another resources. I did it for the NCAA with their alcohol prevention grants. This is about 10 years old, but there's a lot of resources, sample instrumentation in here, probably 30 or 40 different instruments, again, available online. And again, thinking about the planning process, some sample charts. We have milestone charts where we have a blank one and we have a completed one, so you can see what that sort of planning might be like. And you're thinking, oh my gosh, there's so much here. Yeah, there's a lot. So the whole strategic planning process is a thoughtful, deliberate one, but it does promote results. Think about this as a long-term process, not something that you can do in a weekend. This is our 8th step, review and revise. So review how we're doing, some of the monitoring that you're doing, checking things along the way, not just on a 5-year basis. So you may want to do, I know we do the biennial review on every even year, but you may want to do some other pulse checks along the way. And then ultimately, we're promoting institutionalization. That's part of strategic planning. We're not just doing it and having a report and having a plan, but ultimately, we want things institutionalized so that the good stuff remains, and then other things are open for innovation, for refinement, for removal. So as you're thinking about institutionalization, that's all about the support from the top. It's about their engagement and they're saying, I can't do without it. So as you're doing that, you're speaking to stakeholders. Here's a resource. Um, Actually, the National Cancer Institute did it, but it's about how do we speak the language of those who are our stakeholders. We can't, you know, for us to say, um, a certain language like NCHA, National College Health Assessment, or core or biennial. It may speak to us. Selective prevention. It may speak to us, but it may not speak to our bosses. So we got to speak their language. Prepare support materials. I know when George Mason had a new president about 10 years ago, I wanted to brief him about prevention. I was not the campus coordinator. I was a faculty member doing this research and this sort of prevention work. And I wanted to brief him. So I had a 1-page summary and I had a briefing book and I shared it with him. I spent an hour with him and it helped. I saw some things blended into his future remarks, like to new students, which was important for setting the stage. 2 last slides in terms of this. Again, this comes from the Professional Competencies Guide. Leadership is an important competency. And it doesn't mean you're in an appointed position or an elected position. You can be a leader because you may be the knowledgeable one. You may be the one who has the passion. You're the one who's keeping it together. And then communication and advocacy, getting the word out. Again, these 9 elements all fit within that. So this is the strategic planning model. We had 4 clusters. We covered these 9 steps from foundations to organizing groups, all of this, plans and strategies. There's a lot here, and I chose to blend in these 8 professional competencies. So as you look at these competencies, I'm going to say a bit more about that, and then we're going to have questions in a couple of minutes. So just the infusion of core competencies in this guide. Again, this guide is downloadable, it's free. There's this sort of background before you get into those 8 areas. There's the rationale for it, there's how it was developed, where we come up with all those competencies, the advisory group that was part of it. We wanted to increase effectiveness and cost effectiveness and efficiency. We knew that campuses were doing a lot of great things, but often they get into some silos, they get into some tunnels, into some limited scope, and we wanted to prepare something that we called aspirational. It was the ideal, something as we think about the big picture. So as you're thinking about talking with campus leadership, you can, print a copy of this book or come to a workshop I'll do at the NASPA Strategies Conference, and I'll give away a few of these copies that I print. Um, but it's to say the job of prevention on a college campus is not just doing a couple of programs. It's bigger than that, and the skill sets are needed that are much broader than has been traditionally thought. That's why we talk about the skills of leadership, the skills of communication. And so we talk about this. Some of this is highlighted in the book, that rationale. We also say this resource. It's not just for the prevention specialist. You might think it's all about that specialist. Well, there's some skills that are appropriate that we can promote with our colleagues and our campus leadership. And so we wrote up a paragraph on each of those 8, each of these 8 different groups. What can they do? What can they do? So thinking about even our academic preparation programs. And so the perspective is that doing prevention and having the specialists, whether they're full-time or whether it's 10% of their job or it's an area of interest or expertise by someone who, like a faculty member or a staff member whose responsibilities are otherwise, getting them grounded in prevention and grounded in the science. So some other resources and actionable leadership strategies. I've mentioned Alcohol 101 Plus. It's a free resource. It's free resources online. Tom Hall, again, the author, co-author on the NASPA publication upon which this presentation is based. And I did some evaluation. Here's a couple of the findings. Again, I'm not going to highlight them. We did a follow-up study. I noted that a little bit ago where we had a blend of quantitative and qualitative. We're now working on a quasi-experimental design. If any of you happen to be interested in that, we can talk further about that, a quasi-experimental design on your campus or your region. But here are some of the findings. And so it's very interesting to see that we do have some basic evidence that this is helpful. It's not the answer, but it's part of the package that can be used. And again, it's free. I mentioned NASPA strategies. I have a pre-conference workshop with 5 others. So that's a pre-con in Chicago during those dates. I think it's the day before the 15th because the conference actually starts on the 15th. And then I have 3 other workshops, 2 of which are co-presented. A couple of other resources. Here's a leadership book that I put together about 10 years ago. And this book is about a lot of the insights from people who've been working a long time with not just campus, but state and national prevention efforts. So a lot of their rich insights, it applies to colleges, but it's not limited to colleges. This is the college book. Again, we've talked about that. This is the competencies guide that's available along with the webinars. Here are 3 other resources from Rutledge. And then this is the book that's coming out this week. So with this, I have 365 different contributions. I have 214 people who contributed, from a former Surgeon General to some federal leaders, to some college presidents, past and current, student government folks, people from all sorts of walks of life, ages 17 to 93. Each has a 1-page legacy letter. It's orchestrated around the 7 themes that you saw earlier, from optimism all the way through service. Again, I have some worksheets in here. I'll have those on my website. And so This is coming out this week, 454 pages, as I understand it. I have not yet seen a copy. Can't wait to see it. So the summary and next steps, and then we'll move to questions. So here's a perspective. Bill Kane, very active with lawyers, recovery services, lawyers assistance programs. And I think he's the one who's established the Judges Assistance Program, like an EAP for judges. And he said, when I interviewed him for one of my books, it's important for people working in the field to never give up, never give up. And that's the case for individuals and programs. So in other words, the perseverance, the commitment long term. Here's what I set out to do today: practical outcomes, confidence, and opportunities. And it's all about that. It's all about being practical, having the confidence to move forward, and honoring that potential, taking advantage of those opportunities. Again, with the title that I shared, Orchestrating Meaningful Drug Alcohol Misuse Prevention Efforts, the context, the competencies, and collaboration. I think all of those are important. I have an email address here. Welcome to take questions through that. And chartingyourcourse.net is soon to be available, or points right now to the book coming out this week. But it will have other resources from my George Mason University and other federal sites. So I'm going to end the slideshow, and